What is the difference between tachycardia and AFib? Imagine your heart as a busy engine that keeps your blood flowing smoothly. Sometimes, that engine speeds up or becomes irregular, which can be confusing and concerning. Today, let's explore the difference between tachycardia and atrial fibrillation, especially in the context of stroke prevention and risk management. Tachycardia simply means a heart rate that's faster than normal, usually over 100 beats per minute when you are resting. It's a broad term that describes how fast your heart is beating, but it doesn't specify the pattern or where the abnormality starts. Tachycardia can happen in different parts of the heart, including the upper chambers called the atria or the lower chambers called the ventricles. It can be caused by various factors like stress, caffeine, or underlying heart conditions, and sometimes it occurs without any clear reason. Atrial fibrillation, or AFib, is a specific type of irregular heart rhythm that originates in the atria. In AFib, the electrical signals in the upper chambers become chaotic and disorganized. Instead of contracting normally, the atria quiver or fibrillate rapidly and irregularly. This irregular activity prevents the heart from pumping blood efficiently, leading to blood pooling in the atria. When blood pools, it can form clots, which pose a serious risk because if a clot breaks free, it can travel to the brain and cause a stroke. That's why AFib is closely linked to stroke risk and why managing it carefully is so important. The key difference lies in the rhythm pattern. Tachycardia can be either regular or irregular, and it refers mainly to the heart beating faster than usual. AFib, however, is always irregular and often very rapid, with no consistent pattern. Regarding where they start, tachycardia can originate in the atria or ventricles, while AFib specifically begins in the atria. The mechanism of AFib involves chaotic electrical signals causing the atria to fibrillate, whereas other tachycardias might have a more organized electrical pathway, even if they're fast. When it comes to stroke risk, AFib is a major concern. Because of the irregular and inefficient contractions, blood clots are more likely to form in the atria. If a clot travels to the brain, it can block blood flow and cause a stroke. That's why people with AFib often need blood thinners or anticoagulants to reduce this risk. Other types of tachycardia, like supraventricular tachycardia or ventricular tachycardia, usually do not increase stroke risk unless AFib is also present. Age and underlying health conditions also play a role. AFib is more common in older adults and those with heart disease, high blood pressure, or other chronic conditions. Other tachycardias can occur at any age and might be caused by congenital electrical abnormalities or temporary factors like stress or medication. Both tachycardia and AFib can cause symptoms like palpitations, dizziness, shortness of breath, or fatigue. Sometimes, especially with AFib, people might not notice any symptoms at all, which makes regular checkups important. Proper diagnosis often involves an electrocardiogram, which records the heart's electrical activity. Treatment strategies differ. Managing AFib focuses on controlling the heart rate, restoring normal rhythm when possible, and most critically, preventing stroke with blood thinners. Lifestyle changes, managing other health risks, and sometimes procedures like ablation are part of the plan. For other tachycardias, treatment may include medications, maneuvers to slow the heart, or catheter ablation, but stroke prevention is not usually a primary concern unless AFib is also diagnosed. In the context of stroke prevention and risk management, recognizing AFib is vital. Early detection allows healthcare providers to prescribe appropriate medications to reduce stroke risk and monitor heart health closely. Remember, always consult a healthcare professional if you experience symptoms or have concerns about your heart rhythm. Proper diagnosis and management can make a significant difference in reducing stroke risk and improving overall health.